Year. Good afternoon, everyone, and thank you for coming out today and for tuning in. Things are obviously going to be done a little differently today. I'm going to be joined by several guests, and we're going to actually rotate them in and out because we have a lot going on, and this stage is small, and we're going to cover a number of different topics. So I would ask you to kind of understand what we're trying to do today. Just a moment ago, we held our first telemeeting of the Health Equity Task Force. With me now are co-chairs Dr. Sandra Brown and members Senator Regina Barrow and Representative Dustin Miller. Senator, Representative, thank you all for being here today and for the important work of this task force. On April the 6th, and some of you may recall, not necessarily that day, but Louisiana was the first state in the nation to reveal that the data showed racial disparities in outcomes, especially related to death from COVID-19. African Americans, and the numbers were a little different then and so forth, but not much. African Americans make up about 32 to 33% of our state's population, but they represent 59% or so of our reported deaths. And that's a little bit in flux and it changes a little bit, but obviously that is a real issue. That's why we created the COVID-19 Health Equity Task Force to develop short-term and long-term actions to protect all of us. And I'm going to pause here for a second because the work that's done is going to advance the health and safety of all citizens of Louisiana because it's going to be focused on a lot of different things, but these comorbidities, which while they might be present in a more prevalent way in the African American population, they are obviously present in every population in the state of Louisiana, regardless of race, but is also going to look at social determinants of health and other things that obviously impact everyone in our state. And it's also true that since we reported, a number of other states and municipalities have reported data that is similar to ours. But this is one of those areas where we shouldn't take any comfort just because we have company. It's something that obviously is a problem and it needs to be addressed. And so I've tasked the Health Equity Task Force to quickly develop short-term and long-term actions to protect all of us. And of course, the work that they do will be felt most especially by those who are suffering from these disparities. And we know that these disparities have existed for generations, probably as far back as we started studying such things in Louisiana. I've often said that the prayer that Jesus gave to us, it starts with Our Father. What that means is we're all brothers and sisters. And that's true. And it's true regardless of race, or what region of the state we're from, what political party we belong to, and so forth. And so the work will benefit everyone. And there's no greater example of this than when we come together and help one another in need. And Louisiana has a long history of doing that. We haven't done it as well as it relates to health equity, and it's time that we change that. So that's why we're doing this work. And so we do have Dr. Brown, Senator Barrow, Representative Miller who are here. They can take a question or two that you might have that you want to address to them on the work of the task force. And if you want to ask a question, I'm going to ask that you do that now so we can get them to come up and answer the question. After that, we're going to transition to the next phase of the press conference. Yes, sir.
Question for any of the task force members, co-chairman maybe. Some people pointed out that among the frontline workers that are going to be facing the public in the reopening, a lot of them are African American. I wonder if you're concerned about this disparity getting larger as we reopen the economy.
Thank you. I believe your question had to do with frontliners and our concerns when the economy reopens. Well, based on the health equity situation that we have and our African Americans who are more likely to be on the frontliners, our concern is that if their health was poor to begin with. It's going to be worse now. We are also concerned about the testing to ensure that they get the adequate testing prior to going back to the workforce when everything opens up. The other things that we are concerned about with are our frontliners who are healthcare providers. I'm a healthcare provider. I want to make sure that our nurses, our physicians, who are our physical therapists, our respiratory therapists, have the PPEs that they need to protect themselves. There are over 9,300 healthcare providers that are sick themselves with COVID-19, and that is due to the exposure being on the front line. So we have to bring the access of testing availability, and we have to protect our healthcare providers who are on the front line.
Any other questions for this group?
For any of the task force members, what can be done short term? What are the first steps to correcting a problem that goes back centuries?
Well, we have to de-aggregate the data. We have tons and tons of data. And in my interactions with my colleagues, and we've written reports, they're sick and tired of being at the bottom of the list as far as health disparities. Louisiana ranks 49th out of 50th as one of the least healthiest states in the United States, and the governor inherited that situation. It didn't happen overnight. It has been decades and decades of us having that low ranking. And so this task force is a call to action, and I applaud him for taking a bold step. A legacy is not what you leave for others, it's what you leave within them. So this is our time. This is our call to action to take care of the situation, to stop being sick and tired of being at the bottom. We're at the top of the list when it comes to disparities, being affected by COVID-19, and we're at the bottom of the list where we're speaking of health. So we have a disproportional inverse relationship there that we have to address.
What is the action that you're referring to, I guess, and what, I recognize that forming the task force is the first step, but what comes next?
The first thing is testing, making sure that we have access to testing, that we bring testing to the communities that are most impacted. We need to look at zip codes. Where is the aggregate data of these individuals who are most likely to either have suffered from COVID? Is it certain zip codes that we have to target? And that way we can tailor our interventions. There are barriers to testing. And I applaud the governor again for setting up additional testing sites that individuals can walk to. But we also need to look at expanding the hours. If someone is working from 8 to 5, they cannot leave their jobs and go get tested at 3 o'clock in the afternoon or 11 o'clock in the morning. So we need to look at some flexibility with those testing hours, expanding them to evenings, after hours, and on weekends, and bringing the testing sites to the areas that are most likely in need of it, and that's our African American communities.
Thank you very much, Dr. Brown. And before this group leaves, just to follow up on the question that was asked a moment ago, there are a lot of things that we can do in the short term. One of which is to make sure that we're effectively communicating what we know about this virus and this disease and what makes people especially vulnerable to it and to have poorer outcomes. And the poorest of all outcomes is death. And so we need to make absolutely sure people know that if they've got hypertension, kidney disease, heart disease, obesity, diabetes, that they are more likely to have a very poor outcome from this disease. So we are always targeting our message to them to be more careful in the first place and to not do things that will expose them unnecessarily. So even as we start to ease restrictions, which, by the way, is going to be a very gradual effort, those individuals have to remain especially vigilant, and we have to do things to try to help them through testing, as was mentioned. And testing is a big part of what we're doing, have been doing, and going forward, and we're ramping up our capacity. But we also have to change the strategies for when and how you administer those tests, so that you do in fact test more people in the communities that are most vulnerable. But we're going to be testing all over the state of Louisiana as we have been. So all of that is critically important and things that the task force will help us with. And we can continue to learn. And one of the things the task force will be doing, because we're not the only state that's seeing these kind of disparities, is if we see something that another state is doing that seems especially smart and that we might benefit from, we're not going to be too proud to say, hey, look, this is what Michigan's doing, this is what New York is doing, or this is what's happening in Philadelphia, whatever. We're going to bring those lessons to bear here, and that's why this work is so important. There will be things that we benefit from this task force immediately, then over the short term, and then over the long term as well. And I want to thank y'all very much for your work. I appreciate you, Doctor, Senator, Representative. Thank you. And you all can leave now, and we're going to be joined by the next group of folks.
Sorry, Governor.
Thank you, David. Bill, thank you very much, and thank you. So funding is critical to any task force of the type that we just discussed. And to achieve the goals that I have charged them with achieving, that funding is absolutely necessary. And I'm excited to share with you all some news that I shared with the task force earlier today. And it's a $500,000 grant from the COVID-19 Response Fund that is being made immediately available for the work of the task force. And this comes because of some very generous contributions made by the Irene W. and C.B. Pennington Family Foundation. I know Paula Pennington de la Breton is here with us today. We also have Bill Belhoff, who's chairman of the board of the Baton Rouge Area Foundation, and we want to thank him and the foundation for their contribution as well. And then David Beach is with us, and he is the president of the Huey and Angelina Wilson Foundation. And I want to thank them for their very generous contributions that will allow this task force to immediately start work and do all the important things that we talked about in the previous segment, plus a lot of other things that we didn't have the time to discuss. So in addition to thanking them and announcing this particular funding, I wanted to make them available should you all have any questions of them. And if you do, now would be the time to address your questions to these individuals. And by the way, these foundations have been engaged in doing great work in the Baton Rouge area and elsewhere around Louisiana for a very long time in a lot of different ways. This is just the most recent manifestation of the good work that they do, and I do want to thank you all.
So what is the basis for the study? What is it?
This is to fund the Health Equity Task Force that we talked about before. It's a $500,000 that is being provided by these three foundations.
Can you explain what that money is going to be spent on? Why a funding mechanism is necessary for the task force's work?
Well, first of all, you can't do anything meaningful without funding, and quite frankly, this is probably the first installment. I don't think we're going to be able to do everything that the task force needs to do with $500,000, but there may be some opportunities over time, especially with the legislation that's been passed by Congress and some of the funding that comes through. We may be able to tap into some public funding, but as you all know, the most nimble folks out there, the ones who can act the fastest, are in the private sector. And that's why having these people step up as they did so quickly to generously provide this funding that will get the task force started and allow it to organize and start its work. And I don't know whether you're prepared to talk about some of the things that you envision the task force actually spending the money on, but Bill, you're welcome to do that.
All right. Obviously, I'm Bill Balhoff with Baton Rouge Area Foundation, and this actually, we're extremely happy to be able to help fund for the unfortunate, for everybody that's getting sick, but obviously those that are disproportionately impacted by this. So this is something that we're very interested in. My assumption is that the governor is going to try to get together the people that can actually evaluate what's going on, not just to evaluate what's happening, but also how to treat this situation and try to create something that will actually improve the environment. So I'm glad you called on me, Governor, because I was able to take my mask off and I was about to pass out from breathing on myself. But that's basically, I mean, I think it's pretty broad, but Baton Rouge Area Foundation is thrilled that we have the opportunity to participate in this.
Thank you, Bill.
Thank you.
Did you want to add anything, Paul? You're welcome to.
Oh, I can take mine. I just wanted to say, on behalf of My Family's Foundation, we are very proud that we were asked, and we are very proud to participate. And I also want to thank you for your leadership and everything you have done and kept everyone calm, cool, and collected, and that we're moving forward in such a manner as we are. Between the Family Foundation and the private funds that we're going to be able to bring to the governor, and for the monies that the task force will be able to do, will really help the mission of the task force, which is to help with the disparities in our community in this pandemic, and hopefully it will help to alleviate some of the problems in the future, and that if we ever have other crises that the state is in, that we will have a much better handle, and people's lives will be we will not have the rate of death rates and sicknesses that we have today, and that we'll be able to move forward, but in a much better position than we are now. So thank y'all for having us today.
Thank you, Paul. David, anything?
First of all, I'll too thank you, Governor, for your leadership during this difficult time for our state, for our country. My name is David Beach with the Huey and Angelina Wilson Foundation. Our areas of focus are human services, education, healthcare, and prison reentry. And we are thankful for this task force because we feel that it will serve as a launching pad to really understand some of the systemic issues in our community and in our state. And we hope as a foundation to be able to take the action items that are delivered as a result of this task force and apply pressure to change the systemic issues that some of our most vulnerable citizens face, and hopefully end generational poverty in our community to make us a much stronger place to live for all of our families.
Thank you very much. Appreciate that. Now we are going to trade off again, and we're gonna ask these three fine people to depart. But thank you so much. And I'm going to be welcoming Senator Bill Cassidy now, who has been here at GovSep with me today and previously as well. So, Senator, thank you very much. I appreciate you being here. And obviously, we also have another doctor who just came in, and that's Dr. Alex Bu, who's been with me, I think, just about every single day. So Senator Cassidy has been working really hard in Washington and here in Louisiana. And, you know, he's a doctor. He understands this far better than the vast majority of people out there in terms of this virus and this disease and how to go about tackling it. But he's also been leading the effort in Washington to make sure that the legislation that you've been seeing, the CARES Act 3.5 and so forth, that those have meaningful funding and flexibility of funding so that we can address the most pressing concerns, whether it's small businesses through the PPP program or whether it's the hospitals that need shoring up, the testing and all of those sorts of things. He's also been working with Senator Bob Menendez of New Jersey on a bipartisan plan to respond to the urgent needs of states and communities on the front lines of the fight against COVID-19. And they actually have a bill that's introduced, and I'm going to give him the opportunity to talk about that later. In fact, I think I'll just go ahead and do this now. And he may stay with us for the rest of the time. But if you would be so kind, if you've got a question that you want to address to the senator, go ahead and do that after he concludes his prepared remarks. But he's certainly welcome to stay for the rest. I just don't know how long it's going to last. I never know with these folks, and what else you might have to do. But Senator, thank you so much for everything you're doing.
I want to first thank the governor and his team. They have shown great leadership in terms of how do we get our community and our state through this. And sometimes folks say we're of different parties. I say, yeah, but we represent the same state. It is about the state and the people who live here, and it is about nothing else. So again, Governor, thank you for your good work. Appreciate it. And do you mind standing a few feet away? A little close there. We're in another 6 feet distance. Secondly, the CARES Act. Our goal is to how do we balance the financial and physical health of the American people. I tell folks when I worked at Earl K. Long Hospital for so many years, I found that if you don't have financial health, your physical health suffers. If your physical health isn't well, then your financial health isn't well either. Right now, we're really emphasizing that physical health, so people's financial health is just out of kilter. We need to bring this back. So the purpose of the CARES Act 3.0 and 3.5, if you will, is how do we help the financial health get us through this rough patch? We did this obviously with the stimulus checks, both those that went to individuals and families. We also did it for small employers. We need employers to continue to employ people, giving them those benefits that, for among other things, provide the health insurance that they need should they get sick. But also, hopefully, to have that assuredness of a job so that when we are through this rough patch, that they'll have a job to go back to and we'll be able to take off once more in that kind of great economy we had before all this happened. I will say that we found that the first amount of money we put forward to support small businesses and nonprofits such as churches in the PPP program had such demand that it was quickly exhausted. Congress has now added back to that, again hoping to support these small employers so that the people whom they do employ will be financially whole. The second thing I've been working on as related to financial health is what do we do as regards the healthcare industry. Believe it or not, healthcare is losing a lot of money because all their elective cases are canceled. They tend to lose cases if they are filled with ICU patients with COVID. And so it's been real, and not even to speak of the doctors and nurses and med techs, et cetera, employed at, say, an ambulatory surgical center. So Congress has been very proactive trying to support the healthcare community. We need to have the healthcare community providing health when we come out of this rough patch. We don't want to end up in worse shape in terms of preparation for health emergencies than we started off. Next area of financial health would be the oil and gas industry. And the oil and gas industry's got a 1-2 hit, demand destruction relative to people not driving, people not flying, therefore oil and gas not being turned into fuel products. And secondly, a price war between the Saudi Arabians and the Russians. Worked very closely with senators from energy states to speak to the Saudi Arabian ambassador to kind of read the riot act. You're supposed to be our friend, but you're undermining our economy. Why should I have somebody from Louisiana defending you from enemies when you're undermining the economy upon which that person from Louisiana's family depends? I think they got the message. The president made an intervention, and so the Russians and the Saudis have agreed to decrease production by 10 million apiece, 10 million barrels a day apiece. That's not enough, but it's a great start. We're still going to have a rough patch in oil and gas until we get through demand destruction, but that is the other thing we're working on financially. Lastly, about financially, what about cities? What about states? The governor mentioned a bill I have with Bob Menendez. Just like we're providing support for individuals and families and small employers, can we also provide support for the cities that provide the essential services for them to be open? Can you imagine a city which is bankrupt because they depend upon sales tax, hotel bed tax, tourism? It's all gone, and yet they're still supposed to have the money to pay for the police, the fire, and the sanitation to let those small businesses reopen. Again, imagine that small business, a restaurant, trying to attract customers when the city is bankrupt and therefore cannot pay for sanitation. And because they cannot pay for sanitation, garbage builds up in front of the restaurant. We can see that is not going to work. So we're trying to support government as it provides essential services to those small employers. Let me finish by saying one other thing. I have the privilege of being added to the President's task force on reopening the economy. I spoke of the need to balance between the physical and the financial. We've got to come out of the COVID-19 crisis. Until we have fewer people getting the disease, that won't happen. So one thing I've spoken to Dr. Birx, Secretary of Health and Human Services, Alex Azar, people in the CDC, HHS, just spoke to the governor. How can we begin to proactively go into communities that have a higher incidence of coronavirus infection, testing people who may be asymptomatic if they are infected, supporting them through quarantine, so that maybe paying for their hotel room, giving them food. Congress has made money available to do that, so that we begin to decrease the rate of infection so that they don't infect other people. And we also monitor should they begin to have symptoms. It would go a long way, I think, to decreasing death rate, decreasing transmission rate, and creating the kind of right environment we need to reopen the economy. It is what the South Koreans have been doing. The Germans are beginning to do. Those are the two democracies that have decreased the incidence of disease while they are also reopening the economy. I take that as an example. Governor, I went a little long, but if there's any questions, I'll take it now or I'll wait. Yes, sir.
Senator, many Republicans here in Louisiana, including your colleague Clay Higgins, have suggested we need to open up and start opening up by May 1st. Do you agree with that we need to start opening the economy up in Louisiana May 1st?
It has to be driven by data. I'm a doctor first, if you will, before being a senator, and I just know in public health you got to have data. If you find that your transition rate is below a certain level, then you can safely open up. If your transition rate is above a certain level, you cannot. What the Germans have done is there's something which the governor knows all about called R0. How many people does one person infect if she or he is infected themselves? If your R0 is less than 1, then the amount of virus in your community is going down. If it's 2.5 to 3, you're going to have a lot more people infected. So we should monitor the degree to which others are getting infected, the R0, if you will. And if it is at an appropriate level, you allow that economy to continue to open. If it goes up, you pull back the reins. Someone compared it to an accordion. You open it, we can keep opening it, but we always may just go a little bit back in case it gets out of control. We have to be driven by data.
Does the fact that Louisiana's death trajectory seems to be divorced from this flattening of hospitalizations, does that give you pause?
Why would it?
When it comes to reopening, because more people seem to be dying. We're not seeing that flattening.
There's going to be a lag. I think Dr. Fauci has said that. Dr. Edwards mentioned that to me in my private conversation. But as Fauci has emphasized, there is a lag between death and between the flattening of the curve. It's a lagging indicator, right? I'm more interested in the number of positive tests relative to the total number of tests being performed, as well as the number of hospitalizations and the number of people on vents and in the ICU. I think that is a better indicator of how things are going. Anyone else?
Senator, I have a question about the Paycheck Protection Program. There's a component in the bill that requires businesses to spend 75% of their loan within 8 weeks for that loan to be forgivable. Restaurants, for example, right now have seen demand go down, that they're paying people then to just stay home. And those people can make more money on unemployment staying home. Is that a problem or an issue the Senate is aware of and perhaps renegotiating as you guys consider putting more money into that program in the future?
I've had several conversations with the Louisiana Restaurant Association. Melvin Rodrigue, a very prominent restaurateur, sent me something yesterday, which I forwarded to my staff. We have a call scheduled with Melvin, I think, on Monday. We are advancing that before Treasury, speaking of the special circumstances of restaurants in particular. There's another more technical answer I can give as well that we think brings some relief, but we can talk about that offline. But we're very aware and we're very actively pursuing that. Yes, sir.
You mentioned earlier those stimulus checks that went out and are in the process of going out. Is there any talk in Washington of maybe another round of those and another relief package down the road?
So it really depends on how the nation does. That's why I'm so forceful on the need to proactively go to places of higher risk and to proactively test, not just wait for people to show up sick. If we are able to flatten the curve rapidly and find out who's at risk and who's not, then we hopefully don't need another stimulus check because the whole economy is reopening. If we don't make that decision to go after cases proactively, if you have a hot spot, go door to door if you have to. Congress gave the state and cities money to quarantine people. If they can't afford it, we can buy a hotel room. We gave money for food. You can use some of that money for health care. You can monitor them, and then you take them out of the environment where they would infect other people. The importance of this, for example, there was a headline from New York, probably the New York Post. Mother infects 6 children. Okay, so they all live together. She infects the children play with other children, they infect other children who then infect their parents, who then infect their grandparents. If you take out the one person who is infected, for 2 weeks quarantine, give her the food, give her the medicine, give her everything else, watch her, make sure she doesn't get sick. She gets well, but she does not infect the other people. We've got to shut down transmission. When we do that, we reopen the economy, hopefully don't need another stimulus check.
To clarify, Senator, do you see that as a state responsibility, this initiative to go into high-risk places?
I spoke to CDC today, and they are relying upon states to initiate that. The CDC is not prepared to give granular recommendations like that to states, even though they agreed that in some communities that would be a wise move.
Senator, from the standpoint of being a doctor for all these years and from me reporting on these issues for the last 40, I've seen these programs come and go to try to get obesity down and hypertension down and blood pressure and everything else, and they don't seem to work. In fact, I went through the CDC's records for the last 30 years, and we've only gotten worse coast to coast, particularly in the Gulf South and particularly in Louisiana. What is the disconnect, and why is it that the population continues to get heavier and more out of shape?
You know, you're talking about a really complicated answer on that one, brother.
We've got a few minutes.
But I can tell you that is all the more reason that we need institutions like the Pennington that actually come to where somebody lives, as opposed to giving examples or lifestyle recommendations that people cannot live with. As one example, I was on a panel once in Washington, really great people, talking about the need to have organic food to address the issue of obesity. My point to them was, wait, my patients at Earl K. Long Hospital had to take public transportation to the grocery store. They had to take perishables back to their place in Louisiana August heat. And by the way, they got their food stamps card filled, or if not food stamps, they got paid on a certain day of the month. And then they would go to the grocery store and buy things that would not perish but rather last. Those things typically are processed. They're not fresh. So I do think we need more analysis of how that might work. One suggestion I made long ago is if we do have food stamps, give a higher value for use on fresh foods and vegetables and a lower value on processed food, or maybe the same value, if you will. Something like that. But we need to think creatively about that. It also involves the built environment, et cetera. We could go on, but there's a lot of things involved in that one.
Another issue, too, last year you were really a proponent for transparency in the healthcare system long before coronavirus was ever thought of. Are you still a proponent for that?
Oh, my gosh, absolutely. In fact, I just had a great conversation with the governor, but one thing he mentioned, is to steal his thunder, but it's actually a thunder I would use, too. The more transparent we are, the more people trust. And they'll occasionally forgive you a mulligan if they think that you're being transparent. Now, I was speaking back then about transparent pricing. We should know that something cost me $25. Wait a second, you're charging me $250? Across the street I can get it for $25. I'm all the advocate for the patient having the power. But I also think in this process we need to be as transparent as possible. And again, I thank the governor for his ethic on this, because we need that ethic for the American people, for the people of Louisiana, to have everything they need to know to have confidence in the process. Thank you.
Thank you very much. Senator Cassidy, I appreciate you being here and all the long and hard work that you've been doing and continue to do. You know, it was the senator who was the first person that told me that we really should look at reopening non-emergency medical and surgical procedures, inpatient and outpatient. He talked about how not just these profit centers had been decimated at our hospitals, which, by the way, is a big part of the economy, but also we know that our people are sicker than we want them to be, and if they can't go to the doctor, they just keep getting sicker. You're not managing their disease. They then are more vulnerable to the disease that we're trying to protect them from. And so that really started the effort after that conversation, and I'm happy to tell you that pursuant to an order LDH issued Monday, this coming Monday, we will have those clinics and those hospitals back open, maintaining social distancing, making sure they're using PPE and that sort of stuff, but we'll be among the first in the country to do that, and we're doing it in a way that's going to be very safe. So I appreciate the work that you're doing. And it's obvious that I take advantage of the counsel that you give me. Today, we are reporting 401 new cases, and you can see the total there, 26,140. There are 1,697 COVID-positive patients hospitalized across the state. That is a reduction of 30 compared to yesterday. There are 286 of those patients on ventilators. That is plus 12 from yesterday. Unfortunately, and this is always the grimmest statistic that we have to give, there are 61 new deaths to report for a total of 1,601 statewide. I just, obviously we're having some success when it comes to hospitalization especially, and the trend on ventilators today is an outlier, but the trend continues to be good there. And Senator Cassidy, Dr. Cassidy, was telling us how important that hospitalization number is. The death number is alarming, but it is a lagging indicator. But that number that we just gave you, those 61 people, those are all brothers and sisters. Those are parents, those are grandparents, those are aunts and uncles, and so forth. So we grieve for all of them. I want you to know that the Department of Health, in an effort to be more transparent and also to be more accurate in what we're doing, they're starting to report the number of Louisianans who have recovered. It is an estimate. And the number being reported today is 14,927. And just so you understand, a person is presumed to be recovered if it has been more than 14 days since he or she tested positive and he or she is not currently in the hospital or deceased. If the hospital status is unknown, it has to be more than 21 days since he or she tested positive and they are not deceased. So if they're not deceased or in the hospital, then we use the 21-day figure, and then that's a presumed recovery. And I'm really glad to get to that number because for a long, long time I just knew of one recovery, and that was Secretary of Transportation, Sean Wilson, and very, very pleased that he did recover. Further in the issue of transparency, an update on commercial testing. We told you several days ago that we hit the pause button because LDH was taking a deeper dive. They wanted to be able to report in a more granular detail. Before today, LDH reported COVID-19 cases by parish of resident, while it reported on tests by the parish where those tests are administered, and that didn't always match up. You might live in Tensall Parish, but get your test done in Ouachita Parish, for example. The department did this because that was the data that they were receiving from commercial labs, and so there was a little bit of a mismatch. We hit the pause button on reporting the commercial lab tests by date in order to get all of this right, but we now have a fuller picture of the COVID-19 testing capacity and what that looks like across the state. I'm also pleased to tell you LDH came up with an innovative method for reporting commercial tests by parish of residence. And if it's unclear what the parish of residence is for a test, LDH will cross-reference using its Medicaid information. And if that doesn't work, it's going to go to LexisNexis. but we're trying to be as accurate as we can possibly be. And while it was doing its comprehensive review, they also found some duplicate tests out there and removed those duplicate tests from the count. So for the commercial testing number, when you see that number again, it's going to be 129,000. It won't be the 135,000 because there were some duplicate tests that were discovered because of the work that they were doing. Obviously, testing remains critically important. We didn't talk about it today, but it's not just a diagnostic and the surveillance testing for COVID-19. Increasingly important going forward will be the serologic testing for antibodies, which will also tell us a lot. And of course, that's based on the assumption that once you have the antibodies, you're not going to become infected again. I want to talk a little bit about weather. And we're getting a lot thrown at us these days, but again tonight, central and north Louisiana are under a marginal to enhanced risk of more severe weather that could include thunderstorms, flash flooding, hail, potentially tornadoes. Asking everybody to pay attention to that, monitor the weather station or your meteorologist, make sure that you're staying close to your cell phones because sometimes that is the last and best indicator that there is an active tornado in your area. And if you hear that warning, please heed it and do what it's asking you to do. We have a couple of questions from the public, and I'm going to take one, and the senator's going to take one. Phil from New Orleans says that he was laid off mid-March because of the COVID-19 pandemic. He applied for SNAP and received a notice that his claim was rejected. So he's asking me for my advice as to what his next step should be. Should he appeal or apply again? Well, first of all, Phil, you always have the right to appeal. DCFS has what's called fair hearings. If anyone receives a denial letter, there are instructions on that letter with the next steps that can be taken. You do have 90 days from the date of that decision on SNAP in order to appeal the department's decision. And I will tell you that the USDA, which funds 100% of the benefits associated with SNAP, they allow certain disaster unemployment assistance to be excluded from income for SNAP eligibility purposes. The agency has advised states that pandemic unemployment payments authorized under the CARES Act do not meet the same criteria and have to count as income when it comes to determining SNAP eligibility. So this is what that means. The $600 per week that's authorized by Congress in response to the COVID-19 crisis, and we're talking about unemployment compensation, that in many cases is going to put families over the income limit for SNAP eligibility. I don't know whether this was Phil's problem or not. I can't tell you for sure what that denial was based on. And obviously I hope that the denial was a correct application of the law. But I do encourage him to appeal just in case it was not. But if in fact he's getting that $600 per week as for unemployment, that could very well push him past the income limit for SNAP eligibility. For more information, everyone should go to dcfs.la.gov/getsnap. Now, I'll read the question from Stacy. She's from Sulphur, and I'll ask the senator to come get it. And it just so happened he's here today. It says, will there be another stimulus check in the near future?
Thank you, Governor, and thank you, Stacy. This was asked earlier. Whether or not there's another stimulus effect depends on how long this goes. We want folks back at work. On the other hand, if the economic lockdown must continue, at some point I'm confident Congress will step forward to help American families through this. By the way, it's not just the stimulus check, but I think we now have like 20% of people reportedly on unemployment rolls. 20.
No, 20 yeah, I think that's right, 20.
So again, Congress has given extra dollars to the state to be administered through the state unemployment program to help folks through unemployment. So Congress will continue to help the American people through this rough patch. I'm just hoping this rough patch doesn't last much longer. And so Stacy, TBD, I hope not, but if it's necessary, I suspect so.
Thank you. All right, so we'll take a few questions, and there will be a few because I actually have a meeting at 4 o'clock to talk about something the senator was talking about, and that is a need to ramp up testing capacity and bring that testing capacity to the hot spots, in addition to the testing we're currently doing now as we surge. Yes, sir.
Governor, given the number of tests has fallen in Louisiana, the overall number, does this change your position that we only need a small boost to get us to the number we need to be to start reopening by May 1st?
Okay. The question, and I want to make sure I understood it. You're asking me, given the number of deaths that are being reported?
Tests, commercial
tests. I'm sorry.
Yeah.
Maybe the mask prevented me from understanding. No, that particular number doesn't disturb me. We have two ways to measure this if we want to follow the guidance given by the White House on reopening, and that's the threshold criteria. It's being measured over. Thank you very much, Senator. Being measured over a 14-day period, and it has to do with influenza-like illness symptoms being reported. And I think because the flu season is over, they're actually changing that to COVID-like symptoms. Then you have to look at cases, and you have to look at hospitalization. You were talking about cases, so you can look at the total number of cases being reported on a day, or you can look at the number of cases relative to the number of tests that are being administered. I think that's probably the best indicator. Both are instructive. And so we will go back and take a look at tests done on a daily basis, and then how many of those tests were positive, and we're going to look at it each of those ways. And as I told you, we don't yet have 14 days where we can say that we meet the criteria. We've certainly been moving in that direction, but we're going to continue to look at this, and we'll go back and take another look at it in light of this slight reduction in the number of commercial tests that we're currently reporting, and see if it makes any change. And as I've said before, we know that the stay-at-home order ends on April the 30th. We know that something comes next. Whether that looks like phase one of a reopening of the economy, which will be very, very gradual and slow because we don't want to go back to where we were, or whether it's a continuation because we don't yet meet that criteria. We don't quite know that yet. We will get that back to you all on that the first of next week. Yes, sir.
Back to the diversity task force and the health equity work that you guys are doing. We understand that systemic racism and generational poverty have been problems in Louisiana for decades, if not centuries. So what more is there to learn? What more data can the task force collect, and how can you assure us that they're not just going to tell us something we already know?
Well, first of all, you can always find new and better strategies, right? And if we've been doing the same thing for generations and it hadn't been working, the very definition of insanity would be to do it for another generation. So looking for better strategies, things that we believe will make a real difference. The senator mentioned a lot of them here, and of course with his experience being a physician and working out of the Earl K. Long Hospital, which was a charity hospital, I think gives some particular insight into this. But there's all sorts of things you can do about increasing access to care. Y'all have heard me say it. I am a big believer in the Medicaid expansion. I think it helped our state in a variety of ways and been hugely significant. It has improved access to care, primary care, preventative care. We are managing disease better today than we have in Louisiana ever with respect to this particular population. But obviously there's still a long ways to go, and I'm the very first one to say that. I happen to believe, and I don't think there's a lot of doubt about this from the medical community, that had it not been for the Medicaid expansion and the 460,000 or so people who've had access to primary care and preventative care over the last 3.5 years, and they've had their illnesses diagnosed sooner, treatment started sooner, they had access to medication that they could actually afford, and so forth. Our population, as unhealthy as it is, was healthier than it otherwise would have been. And it's always hard to prove something that didn't happen. But I firmly believe that the death numbers, as staggering as they are, would be higher today if we hadn't done the Medicaid expansion. But I'm the first to tell you that Medicaid expansion isn't enough. We've got to figure out what more we can and reasonably should do in order to get people healthier. And the comorbidities may have a higher prevalence in the African American community or the Latino community, but they're also present to some degree in every racial demographic of our state and of our country. And so this work is going to benefit everybody. And everybody's going to have a better chance of reaching their God-given potential and having a healthy life. And I pray that never do our health disparities get exposed again the way it's happening with this particular pandemic, because this exposure for too many people means death. And so that's how important people's health is. And sometimes, I guess we're all a little more attuned to it now, but it's important every single day.
Last one.
Yes, sir.
Can you talk about whether you're going to, the senator talked about this initiative to go into high-risk communities and test those people and maybe put them up in hotels. Are you moving forward with an initiative like that?
Well, we are moving forward with new strategies that we are currently developing. And really, until you surge your testing capacity, your strategy is going to be one that you talk about, but it's rather academic. But we now feel really good that our testing capacity is going to continue to increase. We're working on that. That's what the overwhelming majority of the call I had with the Vice President today and the White House Coronavirus Task Force was about testing. And so we are going to be looking for new and better strategies so that we can make sure that we more quickly identify those people who have the disease and get them treated if they need to be treated. But the vast majority of these people won't necessarily need treatment, but they're going to need to be isolated so that they don't continue to transmit. And he talked about the R-naught, and y'all know we've been talking about that a long time. If you think about what we've been able to do through the mitigation measures and the testing and the isolation, the contact tracing thus far, we in Louisiana have gone from having the steepest growth in cases anywhere in the world to now where we're in a much better place. And if you saw, and we're not where we want to be, clearly, but if you looked at an article in the New York Times last night, I think it was 4 out of about 20 areas that they identified as having shown the most improvement are all Louisiana places. And when you look at the list of places that were showing the opposite, I don't think any of them were in Louisiana. So we've done a lot of really good work with the healthcare community, the work of the Department of Health, and so many people out there, local elected officials. But there's always that next step. And there's always going to be a next step in this fight until there's a return to normalcy, which won't happen until after there's a vaccine. And so we're never going to rest. I am going to start a meeting here in about 4 minutes, and it's all about testing in Louisiana as we surge that capacity, and particularly testing in hotspots. And we know that there are certain individuals, and by the way, you may not know this, but we've already been putting people into quarantine or isolation if they had COVID-19 and they couldn't go home, either because they didn't have a home to go to, or because if they went home, they had people who were there who couldn't possibly tolerate them being there because they're more vulnerable because of their age or their comorbidities, and they just didn't have the space to be able to isolate. And so we've been doing this throughout. Now it's time to potentially do it on a much larger scale, and we're going to do everything we can to make it work, because that's how you successfully get through the crisis and reopen larger portions of the economy over time without seeing the cases spike. So we've got a lot of work to do. I continue to express to the people of Louisiana my appreciation for their patience, for their diligence, for the effort that they're making. For those of you who are not making the effort you should, and you know who you are, I'm asking you to do better as well. But by being good neighbors to one another, we are absolutely going to get through this. And I ask you to continue to lift one another up in prayer, especially those people who are in the hospital with COVID-19 and those healthcare professionals who are caring for them. From the time they get picked up by the ambulance, perhaps, brought to the hospital, and they go through the emergency department, and they get up to the inpatient portion of the hospital, all the way through that. You've got wonderful medical professionals who are at some risk to themselves, obviously, are nevertheless there providing first-class care to the people of Louisiana. I appreciate them, and we should make sure that we are giving thanks for them, but also expressing our appreciation to them and lifting them up in prayer. So we will be back with another press conference on Monday. We won't have one over the weekend unless something happens to warrant a press conference. I don't anticipate that, but I do look forward to seeing you all again Monday. So everybody have the best weekend you can have under the circumstances. God bless you.